Oh, well, all right. Thank you for joining us and taking your lunch break, ideally, with us today. My name's Ethan Fogg. I'm the president of the Canandaigua Chamber of Commerce. And today we're going to spend our lunch hour catching up on some information around COVID-19 in Ontario County. We're joined by Mike Stapleton, CEO of UR Medicine Thompson Health, and Mary Beer, who's the Director of Public Health for Ontario County. Just a couple of housekeeping items and some thanks are in order. Thank you to 10X Town Cleaners for making me look clean and pressed on today's call. Crown Jewelers for keeping us on time. CSA Solutions for helping us enjoy our refreshments with style. Zoom for making it possible for us to be in the CNB community room here at the Chamber, and for Mary and Mike to be in their respective workplaces because they've got other things to do in addition to joining us today, and we appreciate the efficiency that makes possible. So as I said, we're recording today's call from the CNB community room at the Chamber, and we will make it available later this week for folks who may have missed it. And our production manager is Chris Cole. Cobblestone Networks is helping us manage our connection to the outside world. And without any further ado, I'd like to kind of frame today's conversation for our viewers. Oh, there's always a little something extra. Some dates, folks. While you've got your lunch in one hand and your keyboard in the other, a couple of dates you might want to check on your calendar. The 6th of April, we'll be having our annual State of the County, City, and Town. Quite possibly an interesting parallel or maybe bookend to today's conversation, because there'll certainly be some COVID language woven through that dialogue too. On the 14th of April, those of you who are suffering from cabin fever will enjoy a virtual networking opportunity. On the 22nd of April, we'll be hosting our annual legislative luncheon online. So it's kind of a BYO bag lunch on the 22nd. And today's viewers are the first folks to hear that on the 4th of May, we're having a panel discussion on public education and its state within COVID. We'll be meeting with the superintendent of Canandaigua Schools, the president of FLCC, and also the president of Keuka College. So we'll be hearing from really all phases of education, from kindergarten to advanced. And okay, as I promised, we've got friends on this call that nobody came here to hear me. So for our viewers' benefit, the way we've asked our friends today to guide their comments is perhaps to look back at the last year in seasons, phases, if you will, of before, during, and more during, and more during, because God bless, this has gone longer than anybody thought. And what we're dealing with now, the ongoing dialogue around things like testing, especially if you're asymptomatic, vaccinations, the emergence of variants in various parts of the world, and the relaxation of guidelines around things like travel and special events and stuff like that. And COVID is certainly, it's proven itself hard to predict. And in direct contrast, I would say that both Mike and Mary have provided a very stable, predictable, professional, inspiring face of local response. So with that said, and my father tried to raise me right, I'm going to go ladies first. Mary, if you would please, the floor is yours.
Sure. Well, certainly this past year has been unparalleled in terms of challenges. Public health started paying attention to China in the fall of last year, as we started seeing the cases rise in China, and said, uh-oh. And then once we saw it hit in Europe, we knew it was on its way here. So we were working with the state at that time, even before it hit the United States, to dust off our disaster preparedness programs and to try and get ready, ordering additional supplies, that kind of thing. Mid-March is when we, in Ontario County, had our first case. And at that time, there was a lot going on downstate in terms of the numbers were just going astronomically high. And we were fortunate, I believe, in this area, in that when they closed things down, because of all the activity downstate, we were still at a level where our outbreaks were still small and relatively manageable. So that our response, we were able to do what we always do whenever there's an identified potential disease that is communicable. We do an investigation, and then we do legal isolations and quarantines as needed. So that was the activity for most of the spring and all through the summer. And we had to continuously adjust because as time went on, you recognize you can't do this by paper. The state came out with some technology for us to use, and as with any technologies, it's the stumbling of how to perfect that technology to make it really usable. And over time, it really has just been about continually to adjust to the changes, whatever those changes are, adjust to what the science is telling you, and responding to what is coming down from the State Department of Health. Definitely challenges from that. We definitely saw a governor who took total charge, and it was definitely just coming down from the top, and this is how it was going to be, and to adjust to that. And adjust quickly, because unfortunately, what was really challenging was often we would hear of an executive order from a press conference that would impact our community or our work. So we wouldn't have guidance on that executive order for several weeks to a month. So that made it really challenging. But once again, you do what you need to do to communicate, educate, and give out the best information that we have at the time. The other thing is that that's really a challenge. I think we live in a time where everyone believes that we have the answers to everything, or we should have the answers to everything. And this is an example of you just don't have, and even today, we still don't have all the answers. So it's an evolution. We learn and have to adjust based on what we know at the time and do the very best that we can. Our role was to educate, to investigate each case, to isolate, quarantine, and try to keep those numbers down. And we were pretty successful at doing that, successful as you can be, in terms of we were able to keep the numbers very, very stable for a very long time. Our biggest outbreaks had been in the nursing homes. And other than that, we were able to, again, identify one and circle the wagons around that individual who was positive to try to keep the spread down. We saw when things started opening up in the fall, that's when our numbers really started to climb. And luckily, we had already foreseen that was going to come at some point. And we were very supported by our Board of Supervisors in giving us additional staff, additional resources, so that we could meet the demand. You know, and when we hit around Halloween, and the Halloween parties were when it really started, that we saw a lot of community spread, and we could trace them right back to what party they were at that caused them and then their family. And that's an awful lot of what we've seen, is that it is community spread from family members to family members. Very difficult if you have a family member in your house to not spread it to others, because it is very, very communicable. And then we would have some pop-ups here and there. Again, 2 of our nursing homes in the county have had significant clusters, we refer to them as, and also significant death. And that was very, very sad. We did count every single death in our county. Our numbers were always higher than the states, and you've seen all the reporting around the challenges that the state had in terms of it. But we did watch, and we traced every single case in our county until they either recovered or if they did. And anyone who died was counted. So we did get a lot of flack at that. And went, why are your numbers so much higher? But because they were true numbers, because we are small enough that we've had 104 deaths. So we have been able to track every one of those. So sadly. And so then after that, we began preparing, because knowing that the vaccine was coming, after the surge in the holiday area, that was our biggest surge, right after all the holidays. and really working hard to get those numbers down. My staff were really busting and really working a lot of hours to try to get those cases down. And eventually we did. And so now what we're doing is we're still doing our contact tracing. Right now we're experiencing around the average of about 20 cases again a day, which is manageable. And again, quarantining and isolating all of those individuals, monitoring them, because we're also responsible if somebody's under a quarantine or an isolation. The county is responsible to make sure that they have what they need to be able to quarantine. Luckily, we didn't need to do very many, probably less than half a dozen that we had to put up outside of their own home. So, but we did have agreements with a few hotels that we would be able to do that. So then now what we've shifted and doing, continuing to do the contact tracing, but also we are now in full stream of giving vaccines. So that came out for the local health departments. The first 3 weeks of vaccine, because it was very limited, has been directed by the governor who can give what and when. And so that's been a challenge. And so I know a lot of people have written to me and said, why aren't you doing more? And well, we're doing what we get because there is limited vaccine. And at this point, though, it is starting to flow a little bit more readily. And so to this date, we have vaccinated 33%, or no, 38% of individuals in our county that are over the 18 age have received their first dose. And that's #1 in the region. So that's really pretty good. In the Canandaigua area, so we've done 33,541 as of yesterday in our county. And that doesn't mean just the county. That's between the hospital, the county, but people going anywhere, going to Monroe County or going up to Syracuse or whatever, because people certainly were anxious to get it. And some people were traveling pretty far because they were so anxious to get it, and it was limited and people were scrambling for slots. That's improving. More and more vaccines available. And so now what our strategy has been, because of our limited supply, we were told specifically by the state who we could vaccinate and who we couldn't when we got the vaccine. So initially we could only do the healthcare workers and teachers. And so we did a strategy where we did not open up our slots. We really did work with the schools, and we worked with other providers to make sure that here's your slots, fill them before we opened it up to the whole community. Because what we found is we did try one time to open it up, so because we were trying to get the teachers done. And what ended up happening is we ended up with like 30 teachers from Trumansville who drove all the way down here. They had almost like captured our slots. And so after that time, we worked with the superintendents, and we gave them to them, and then they gave them out. And that was very effective because now everyone in the schools that has wanted a dose has received a dose at this point. We use the same strategy with the OPWDD organizations to get their residents and their staff who wanted it done. We did see quite a few clusters in the OPWDD homes in our county. Actually had no idea how many there are. There really are quite a few. And we did have a few deaths in those homes as well. Again, very hard for that community not to spread it amongst themselves. And what would happen too is one of their staff member works in one home, but then also works in another home and works in another home, and they would be spreading it home to home. So that was a challenge in working with them to try to get those clusters down. So at this point, the state has allowed us to vaccinate anyone who's eligible, and they give us a certain number of slots of a month or a week, and then we set up our clinics to do that. This week we're having 3 clinics. We have one going on right now. Our clinics have been drive-through clinics. We have the capacity to do 1,200 a day. We don't have that much vaccine to be able to do that. Mostly we've been getting Moderna. We have gotten a little bit of Pfizer, but most of our doses have been Moderna. The other thing that's new is that just today I got our first dose of Johnson & Johnson, and we're working on a strategy to work with the homeless, or not the homeless, the homebound, those individuals who really can't get to a clinic. We are going to do a pop-up clinic at Fort Hill. We went out there yesterday and met with them and looked at their space. So we're working on trying to make sure those individuals are set. So we're going to be reaching out to all of the apartment places like that of the elderly. We also have done 2 pop-ups in Geneva with the Mount Olive Church, and that was specific to be able to address, in Geneva, we have a larger population of African American and Latino individuals, and we have successfully vaccinated 500 individuals at those 2 clinics. So we're very proud of that. It was absolutely wonderful to work with. The volunteers all came from the church, and they all just were so pleased to come. And working with the community like that, they really drew in that population that really does have a lot of hesitancy. So that was a very successful venture for us. So we're just continuing to do our best to, as much as we get out, try to give it out. So I'll just give that as a, so we're busy. We've been busy. I haven't had a vacation in a year. I've had maybe one day that I didn't look at my email. So it's been a busy, busy year, but it's also been very rewarding because I think compared to some regions, and especially downstate, I think our community has done really well to work together. We're very fortunate to have 3 hospitals in our county that all have stepped up to the plate and been working really hard to address this issue. And I'll let Mike take it from here because they certainly have been working extremely hard and working very closely with us.
Thanks, Mary. So I'm actually share a couple slides with everybody too to guide my portion of the conversation. And some of the stuff will be repetitive from what Mary just said, but the first part is on behalf of all 1,800 of our associates is thanking all of you. The community support that we received was just phenomenal. Whether you're talking about all the food deliveries, Simply Crepes was basically here, I think, every single day from 2020, dropping off food. All of the letters of support from the community, people painted rocks. They did sidewalk, art with, words of encouragement. We even had a flyover, for Christ's sakes. I mean, the support was just awesome. And I can't understate enough how much that support meant to all of our associates, particularly at the beginning, because the beginning was very, very stressful. Mary was talking a lot about the data. This has been a great tracker that we use on a daily basis that shows everything. And, this is the tracker from yesterday that shows we had 24 new cases yesterday. Our total number of recovered, there's the deaths that Mary alluded to. But this particular slide back here really tells a story, and I'm going to let that guide me as I continue to talk to you. So this is the total number of positives that we have had in Ontario County through this whole pandemic. So you can see back, a little bit over a year ago, we hit the anniversary last Wednesday. There really wasn't a ton of COVID positive patients in our community. Mary alluded to that first patient. That first patient ended up really scaring us a lot because that first patient ended up at our urgent care in Farmington, was transported down here by EMS. Our physician went in to see the patient. We had done all the donning and doffing drills. We were prepared for our first patients. We took care of that patient. That patient actually was not sick, so that patient went home and then was on quarantine at home. And then that doctor who took care of that patient the next day had 102 fever. So that really, really scared us because we're like, hey, we just did everything right, and this doc is febrile. So that was a sleepless night for a lot of us until his test came back, and his test was negative. So we knew that we did do stuff. But kind of as Mary said, kind of all the way back here, March, April, in May was all planning. It was constant planning, looking at guidance from the CDC, looking at guidance from the state. And a lot of times that guidance from both of them didn't mesh up. So you'd be on a call at 11 o'clock, you'd put a new policy in place, you'd educate everybody, and then at 5 o'clock it would change. And then you put a new policy in place, adapt to that, you'd be finally getting home at 8 o'clock, and a new email would come out, the Department of Health wants to have a call at 8:30, and it would change again. And that's not an exaggeration. That's what was happening on a regular basis. So, we shut everything down in the middle of March, and that was a decision that UR Medicine made prior to it being an executive order. So we actually shut down all of our elective OR cases, all of our cases in the middle of May prior to being told to do so. And the main reason for doing that was to preserve PPE. Those of you who've come into the operating room, you know everybody's gowned, everybody's gloved. We needed to make sure we had enough PPE for the frontline associates to be able to take care of that. And at the same realm for us, when we were establishing our surge plans, you know, those OR staff and our diagnostic imaging staff had to be retrained and reoriented to be ED nurses, floor nurses, ICU nurses, so that we would have enough staff to be able to take care of the expected surge. So Mary alluded to, if you see in the beginning, right, the blues are community members, the pink are positives in nursing homes and long-term care. So that was the first spike that we saw. And then this was a pretty significant spike because it was 2 of the nursing homes. It was both Elm Manor and the centers. And this is really the first time that we really felt it in early May. But then through the summer was pretty benign. You know, we saw kind of a couple cases here and there, but, you know, back into the middle of May, we opened back up. We opened everything back up like right here, even though this spike was going on, because we knew we weren't going to see the huge surge that we were seeing downstate. So we did open everything back up from May, and even during the big post-holiday surge, as Mary alluded to, we didn't close or cancel at anything. We didn't cancel a single surgery. We didn't have to change anything we did. So we were able to care for the community from the surge perspective, and at the same time, still do all the elective surgeries, still do all of our pre-admission testing, all of our diagnostic imaging, all of our lab work and everything else. Where surge planning really changed here is we had to develop another level of surge, in that, you know, all of our surge planning back here was simply about patients in beds. And, you know, we on a daily basis, we staff 90 beds. Our surge plan had us going up to 147. Our max down here was 119 patients. That was the most we ever had in the hospital. So we didn't have to go all the way up to our final level of surge, which was good, you know, because at that point it was me and Kurt and others taking care of patients, and that would not have been good for the patients at that point. But the other level of surge that we had to make is because of all of these holiday gatherings, we were seeing a lot of our associates going out. So back in here, we had all of our associates. None of our associates were getting sick. We were protecting everybody inside the hospital. But when the community spread spiked up, at one point, we had a max of 100 associates out at one point. And that had a big impact on us. And that's where we had to really enact our surge plan. So this was a very, very tough period, very, very busy, incredibly high acuity. The patients that came in with COVID, you know, typical length of stay in a hospital is 4.5 days. COVID patients were staying in a hospital anywhere from 12 to 17 days. And they were very, very sick, requiring a lot of resources. And the other part of it was the nursing homes weren't taking patients, so we were backlogging. And that's one thing that I was really proud of some of the decisions that we made, is back in here when the governor said, you will take COVID positive patients into your nursing homes, we said no. Because we firmly believe right from the very beginning that putting COVID positive patients in a nursing home is like putting a match in a pile of dry grass, and we refused to do it. And we took a lot of flack for refusing to do it, but it was the right thing to do in the safe way. You know, up till December of this year, we only had 1 positive resident in our nursing home, just 1. We had a small outbreak around the holidays. It was 14 residents, but we were able to contain that and minimize that spread, and none of those residents passed away. And I won't go into the statistics of the other nursing homes, but just suffice it to say that didn't happen there. This is another one that tells a lot of the story, and this is the patients that were admitted throughout UR Medicine hospitals throughout the pandemic. So you can see our 2 early spikes. You know, when you look at all the UR Medicine hospitals, Strong, Highland, us, and our Finger Lakes affiliates, you know, we were only at about 100 patients a day. You know, so there really wasn't a big surge, and that continued throughout the summer. But then again, you can see what happened during the holiday surge, as we called it, you know, well over 400 patients. And the way this all worked out, there was about 200 to 250 patients at Strong. There was about 80 to 90 patients at Highland. We had 40 to 50 patients, and then our affiliates had a couple straggled patients here and there. But that doesn't tell the whole story, because the issue is pretty much every single patient that needed to be admitted to the hospital had to be in the ICU. And so ICU capacity was the big challenge, and has continued to be the big challenge. Because as you can see, even though we're coming out of this, we are coming out of this, but the numbers are pretty much exactly what they were in the first 2 spikes when all of this started. So while we are coming out of this, our incidence in the community is very low. We're still not done with this. So where are we now? Just as Mary said, and this is what she was referencing, it's all about vaccines. And we are all very proud of how well Ontario County has done. We're over 32.4%. The greatest challenge for us, as Mary alluded to, is actually getting vaccines. Because we're doing so well, we're not getting allotments from the state, because they say you're doing well. You're leading the Finger Lakes region. We're going to give more to Monroe County. We're going to give more to Orleans County. So we're begging, pleading, and stealing, not literally, but to get more doses. And in fact, people always ask me, what is the benefits of this affiliation with UR Medicine? Well, this is another perfect example of this. Throughout all of this, we've had our incident command, and it's great to be sitting at incident command with the university and have an internationally known infectious disease docs, internationally known epidemiologists guiding us through this whole process. But now that we're in the period of the vaccines being the priority, they've been a huge benefit because we're getting reallocations from them. So we got 1,100 doses this week that we're giving along with our second doses because the university allotted them to us. And that's the way we've gotten our vaccines the last 4 weeks. Mary's been able to allot a few doses to us as well, but that's what we want to continue to do. And, there is nobody more focused in this health system to get these vaccines in arms because we're the ones that have been on the front lines of all of this. We want to be done with this. As Mary alluded to, we want to go on vacation. I don't want to work every weekend. We want this to be done. What I actually tell my associates, I want this to be done because I want to go to a bar, I want a beer in my hand, and I want to listen to live music, right? I mean, that's what we all want. And that's why, everybody through this, all of our associates has been incredible. I have not had one associate say no to us. When we have asked them, we need you to do this, we need you to cover this door, we need you to come, nobody is saying no because everybody is motivated to move forward. This is a cool allocation that the Finger Lakes Vaccine Hub shows, and it shows where all the vaccines in the Finger Lakes region are going. And you can see in the beginning, they were all going to hospitals. It was for us to get our frontline associates vaccinated, which we did. And we were able to do that pretty quickly. And then we were able to move out to the other 1As and 1Bs in the community, like our EMS providers, fire, police, the school teachers, OPWDD, and everybody else. But then as you can see, specific to us, they stopped giving them to hospitals. And one of our arguments were, you got to continue to give it to hospitals because we're the center of healthcare in our communities. Don't stop giving it to us. And finally, they started listening and started giving them back. But you can see this green here. This is the FEMA clinic that was set up at Kodak. These are all going to the local pharmacies. I still haven't gotten an answer. I keep asking why they stopped going to the pharmacies. Well, I think the reason of that is because the pharmacies have not been able to allocate it as quickly as the hospitals and the county health departments have. So they're just not getting as many doses now. And as you can see, they're starting to kick up both to the county health departments and the hospitals as well as we continue to meet this need full on. And this is a really cool graph that will give you a lot of optimism, right? So what they're saying, what all the epidemiologists are saying right now is that for us to get to herd immunity, we need to get to 80% vaccination rate. And this is for the entire Finger Lakes region that right now we're at about 33%. But if we keep at the projected and at the current and projected levels of vaccine allocation, getting these vaccines in arms, by the end of July, we will reach herd immunity. Now, this had just moved from like the third week of June because the number of allocations has actually gone down a little bit, as I just showed you on this slide. You can see our total numbers have gone down. If we can get back up to these numbers, we'll hit herd immunity by June. And the J&J vaccine is what's really going to have an impact on that. One dose, one and done, we'll be able to just pump people through the system because when it's two, as you know, you got to bring everybody back in either 21 or 28 days. But this is the end point. Now, with that being said, you've asked us to talk a little bit about the variants, but let me just speak a little bit. So we've given over 12,000 doses. And now, as Mary said, we're allowed to now give doses to anybody who's over 50. And we're really focusing on the chronically ill population in our panel, those 16 to 64-year-olds that have chronic conditions. And the good thing is all we have to do is run sorts and lists through our electronic medical record and find out exactly who those people are. So we're able to do 500 doses a day, 7 days a week in our clinic. And this is just kind of a couple quick pictures of our clinic that I will just fly through real quick. It's set up in our cafeteria, some of our local EMS providers, and then a bunch of our staff as they're filling out. And I love this one. Why are you getting it? Because I want to go back to normal. And the one thing I will say about vaccines that I've told everybody who's been asking me is my simple impression, my simple advice about the vaccine is you have two choices. You either get COVID or you get the vaccine. That's it. And people who are hesitant to get the vaccine, you're going to get COVID. Plain and simple. And right now, we do have these variants out there. And these variants out there are why there are still all of those guidelines around international travel. Everything's opening up for domestic travel, but there are those variants out there. And talking with Paul Grayman, who's that international infectious disease doc working at Strong, we just talked to him yesterday during incident command at the university, and he is very concerned about these variants. And international travel is what's going to allow these variants to particularly restart here in the community. So that's why It is so vitally important that we continue to wear masks, we continue to social distance, and people get their vaccines. Every variant that is out there has shown the vaccines still work against the variant. You may still get it, but you're simply not going to be as sick. All right. But that could all change. Who knows? We don't know. But the big message is we can't become complacent, continue to social distance, get your vaccine, and we'll beat this thing and get back to normal as soon as we can.
Wow. Well, if nothing else, I'm going to start with literally 500 thanks. We have roughly 500 business members across the region who have benefited directly from your leadership, both of you. The Finger Lakes, no county in this region operates alone. You know, I commute across a county line to and from work. Many of us, even during the most restrictive times, may dash across a county line for groceries or a pharmacy or something like that. And something that I was mindful of reading some of those graphics is, I'm not going to ask you a provocative question like, did the lockdown really do what it was intended to do? But I'm wondering if there has been discovery that our local experience, our local curve changed after lockdown was lightened up. Is that a fair assessment? That's just me. You know, I'm not trained at this. I'm just looking at a graph and comparing it to the calendar. It looks like when we were our most place bound, we had the most success controlling contagion.
Yeah. So,
you know, the weather got warm and the people went outside, and then things got, the shape changed.
My 2 cents about that from the very beginning is when we locked everything down, we closed everything, we canceled it, we had no choice. Nobody knew what was going to happen. I mean, one of the funny parts of this is we had all these statisticians, these analysts making these projections, right? Well, I wasn't the smartest student in the world, but I know most analytics are based on historical data. And I'm like, how the hell do you know? There's no data, right? So my point in saying that is we had no choice. We had to lock everything down. As things opened back up, that spike you saw had nothing to do with things loosening it up. It had to do with families getting together around Thanksgiving, Kwanzaa, Hanukkah, and Christmas. That's why. It was family spread. It was holiday living room spread, as we called it. So, you know, there's always people that are going to second guess. You know, one of the biggest second guesses I have, and then I'll let Mary say it, is, you know, the message that came out from hospitals nationwide when this all started was stay away. Help us, protect us, so that we can take care of you. Well, the problem was, particularly in the beginning, I can tell you right now, there were more people harmed in our community because of that message than from COVID, because there were people who put off care. There were people who were sick who didn't come to the hospital, and they should have come. So that is something that I think when the historians start looking at all this data, they're going to say that wasn't the right message. You know, here's a perfect example of that. You know, I like numbers and data, right? So in that time that we closed everything down, we do 250 mammograms a week here at Thompson Health. So for an 8-week period, we did no mammograms. All right. So quick math, that's 2,000 mammograms. The positive incident rate of cancer is 5 per every 1,000 mammograms. So in that 8-week period, there were 10 women who should have come in from Ontario County for mammograms and would have been diagnosed with cancer and wouldn't. So what do I hope and pray? That they have since come back for their mammogram. Because what I don't want to see is somebody to not get their annual mammogram in April of last year and is now waited all the way to April of this year. And what would have been stage 1 is now stage 3, right? That's the kind of stuff that we're talking about with this. And I can go through all of the preventive measures that said that. But the reality is the decisions that were made at the federal level, at the state level, and the local level to shut everything down was the right decision because we didn't know any better. You know, that's just the way it is. You know, now we're learning a lot more. And as long as you're wearing a mask, you're socially distanced. Yeah, but we just didn't know back then. Nobody knew. And so you had to make those decisions on what you thought was in the best interest, you know, for us, of our associates, our patients, our residents, and the community as a whole.
Even in the beginning, they were saying, oh, you don't need to wear a mask. It doesn't make a difference. So, you know, again, you learn and you adjust as they find the science. And Mike is absolutely right that we did see a lot of people who put off a lot of care, and that is not the right message. We really need to make sure that does not happen, and that. But however, even if you're vaccinated, you need to be wearing the mask, and as much as possible, you know, we need to be smart. I mean, there's you know, total isolation, but then there's reasonableness about being around your family and how you can do that safely. And I think that's the message at this point, is that be careful, be safe. And I think we do need to try. I mean, people are tired, people are depressed. This has been a very, very tough year for so many people. Mental health issues are way up, and we really need to do our best to reasonably get back to the new normal.
And you talk about the new normal, I'll jump on before your next question. There's been a lot of positives that have come out of this too. And, we'll talk more about that maybe in another event, but I'll tell you the greatest positive that we're living with right now, there's no flu season. We're smack dab towards the end of the flu season. There have been 600 flu cases in this country, in the state of New York. That's it. So why? Because we're all wearing masks, we're social distancing, and we're washing our hands. When you look at the numbers that flu inflicts from a number of deaths to the number of people sick to the cost of our health systems, it's tens upon tens of billions of dollars a year. We've eliminated it. That's something that, moving forward next year, I can tell you, COVID won't be gone, but there'll be more limitations. But I can tell you right now, my family's wearing masks from January to March, 100%, even when they get the flu vaccine, because it's safer. It's a safe way to do it.
Well, several thanks I want to point out. One is thank you for, you didn't use the words, but I think that's where we're going. The difference between correlation and causation, that the risk can be you look at a set of data and you make assumptions that are faulty because you don't understand all of the influences at play. And also, I have to take a moment and kind of face the audience and thank so many of the businesses that you've said several times, both of you, that the guidelines sometimes have changed several times in a day.
Yeah.
And the word pivot, I think most of us want to remove from the dictionary at this point, but the number of businesses who just have tirelessly, okay, we'll do it this way. Okay, new discovery, we'll do this. Yes, the instincts for survival is strong in people and in business, but it's bigger than that. I've had the privilege of walking this street for a long time. And, the people and the businesses who have made the conscious decision to not only weather the storm, but to do it in a way that is mindful of the needs of others. And Mike, thank you for opening the door for future use of masks after the pandemic is arguably considered history. Because part of what I've talked about in certain rooms, and forgive me if I offend anybody on the call, is to use the analogy of the way 9/11 has influenced travel for 21, 22 years now, that we still take off our shoes before we board a plane. We still don't walk our friends to the jetway. That I imagine there's going to be things that we do differently for the course of my life based on what we've just been through for the last year. Do either of you have any direct thoughts on what we might be doing differently in our lives as a direct result of the pandemic for a while yet?
Where'd Mary just go?
The dressing room,
it just goes. It just goes to what I just said, Ethan. Is that I do think that, the flu seasons are going to be profoundly different. I also say to our associates in new orientation and stuff, and I talk about hand washing. I say, if you are not incessantly washing your hands today, you should have your head examined. So that's just another thing that makes things safer. You have any contact with another human being or an animate object, you should be washing your hands. I do think that those behaviors that will continue moving forward are going to help. I do think, I hope to God there's concerts, by the end of the summer, but you're going to have to show your vaccine card to get in, so make sure you're not losing your vaccine card, or, you're going to have to go for a rapid test. And that's one of the questions too, you asked about, testing and asymptomatic testing. We just started that in our urgent cares a little while ago, and we caught a lot of flack because we weren't doing it earlier. And there's some reasons why we were not doing it earlier. And the big point was, especially if you go back to that graph I showed you, early on in this pandemic, there was not enough tests. So we felt it was irresponsible for us to do asymptomatic testing because we had to do it for the symptomatic patients. That was one piece. And then when a lot of the asymptomatic rapid testing were coming out, there's a lot of false negatives. It's a 16% false negativity rate, right? That's scary because you don't want people running around with COVID who think they're negative. So we actually answered the community demand, because that's what it was. It was consumerism that drove us that way to offer the rapid tests. I think that demand's going to dwindle as time goes on, but it will continue with travel. And then when the concerts, if you have to show evidence of a negative test before you could get into a sporting event or a concert along those lines, that's going to have an impact as well.
Thank you for that clarity. Something that's been on my mind, and I'm sure it's on the mind of some others, is I think if I counted correctly, there's 3 different vaccinations on the market, on the US market anyway.
Yep. Yeah, so it's Pfizer, Moderna, J&J, and then AstraZeneca will potentially be coming out. They've got to go for the EUA authorization and then CDC approval.
Gotcha. Can you, from a clinical standpoint, offer us the 100 level pitch on what the difference might be? Because otherwise, wouldn't they all just be the same thing?
So, there's a multitude of differences. I'm not going to get in all the clinical differences, but here's the message about it. Get whatever vaccine you can get now, plain and simple. Don't put it off. There's a lot of people who are talking about waiting for J&J because it's 1 dose. Well, you have a high likelihood of getting COVID between today and you get the J&J vaccine. Don't put it off, right? They all work. There's the whole that Moderna and Pfizer were 95% effective. Then people originally were like, well, I'm not getting J&J because it's saying it's only 67% effective, but it was 100% effective against ICU admissions and death, so that's a good thing too, right? And, in all of these, they're still learning about it. Over time, it may come up that people who had COVID, who already have antibodies, may need just 1 dose of Moderna or 1 dose of Pfizer, don't need the 2. I have not read enough about the AstraZeneca one yet to know if that's 1 or 2 doses. Pfizer was a little bit of a challenge because it needed to be kept at minus 80 degrees Celsius. So we had to have specialized freezers for all of that. And then once it's thawed, it has to be used in a very short period of time. And then Moderna is similar, but it doesn't have to be at that extreme. But those are all things that have presented, huge challenges with the logistics of how do you get it out? We don't want to waste doses, right? We want to get every dose in every arm that we can. And so that certainly has presented some challenges, but we've met them head on. And now, there was some wasted doses by everybody in the beginning. As we figure this out, now there's no waste at all. We have 2 doses left over after a clinic. We walk into the ED and see who is eligible, and we give them those doses. Get whatever dose you can get, plain and simple.
Fair enough. We've had some people in the chat actually, and so far I'm not seeing questions so much. It's kind of warming my heart here. What I'm seeing for the most part is accolades, appreciation for your efforts and those of the county health department. And let's see, that's pretty much what I'm seeing there. Part of what I suppose is on all of our minds is we really, whether it be anecdotal reports we're hearing from our lodging partners and our restaurant partners, or even the difference we're seeing of volume on our highways, there's pretty obvious indicators that there's more and more movement. And I'll confess, I've traveled cautiously. I've not dawdled point to point, but I've checked on family that needed checking on, and did the whole testing and the quarantining and all of that. Any words of wisdom for the traveler? Because
so I think
just telling them don't isn't going to work.
No, and I'll be very direct and personal. I'm leaving Friday for South Carolina. The first vacation kind of married the first week off since March of last year. And to say we're crispy is an understatement. We basically had to force the entire executive team to take time off. It's time. We got to go. So normally this time of year, we would go to Florida to see my mother and run all around the parks in Florida and everything else. Not doing that. Not doing that this year. Florida's a disaster. I wouldn't go anywhere near Florida, and I wouldn't leave the country. We've got the ability. We got a little beach house on the beach. I plan on sitting on the patio of the house. I'm going to play some rounds of golf outside. We're going to eat at home. We're not going to go out to restaurants that I feel very comfortable going to Nolan's because I'm right here as an example. I'm not going to some place I don't know, and I'm not going to go to some place that isn't mandating the masks and everything else, even though I'm vaccinated and the majority of my family that's going is vaccinated, just not taking the risk, but it'll just be good to get out to some, consistent warm weather. People just got to be smart. International travel should not be happening like that. And that's a message that I've told our associates, and I'm going to tell them again in an email tomorrow. This is not the time to be traveling overseas and out of the country. There's still so much out there that we don't know. These international countries are not doing what you need to do with COVID. Don't do it. there's plenty of places you can go that are safe within the state. You try to get a cabin in the Adirondacks right now for the summer, you're not going to go, because that's where everybody's going, and, just stay safe, be smart. We would normally fly when we go away. We're not flying, we're driving, we're going to be together in the car, and, you just got to be smart about it. And if you're smart, again, we're going to get out of this, but just be smart. But, it
Ethan,
is
this
time.
is Mary. Ethan, I'm sorry, my internet went down, so I'm on the phone. And I would have to concur with that. And one of the things that we're seeing and recommending is there are certain places, look about where you're going. Some places are worse than others. Most of the cases that we're seeing coming from out of state are definitely coming from Florida. But again, you can go to Florida safely, I believe, if you are very careful. It's important that if you walk, and that's even true around here, if you walk into an establishment and they're not wearing masks, you ought to really just turn around and walk out. You don't need to, eat there, go somewhere else. Or like I think Mike said, not go into a restaurant or do takeout. You can be safe, you need to be smart.
I'm going to take what both of you have said and respectfully turn it around 180 degrees and say that it's not just the Adirondacks, Mike, that are selling out. We're seeing a lot of people coming to the Finger Lakes.
Yeah, absolutely.
Yeah. We're seeing, and perhaps we haven't even seen the people yet, but we're seeing statistics of, summer rentals are just crazy hot, and they're selling it, renting it above market. So maybe how can we be better and more sensible hosts? Whether we're the operator of the venue or whether we're hosts in that, I run into them on the sidewalk and they ask me, hey, what's there to do in this town? How can we help make them smarter, perhaps, or, feel welcome with a mask on?
Yeah,
Well, definitely our visiting center is certainly working with our tourism and working really hard to get good guidelines out there and recommendations. And we want people to come and enjoy our beautiful area. But again, to do it safely. And, we have a lot of wineries and they're all working hard to put into place things that are going to keep everyone safe. And I think that's the key. Valerie Nowak is doing a really good job in working with all of those areas. And I think we can safely bring people into our area. And also, though, watch as we see what's going on. If our numbers start going up, then we're going to have to be concerned about what more can we do.
Fair enough. I've got one more question, but I want to wait because I don't want to lose the wind we're riding right now. The idea of if numbers begin to change, without putting you on too much of a, because we just spent most of this call talking about the fact we learn something new every day. How many days in a row of change constitutes a change worth attention?
So there's been a bunch of different ways that we've looked at this, from the 7-day rolling average to a 10-day rolling average to the main way that a lot of people started looking at this, way the governor started looking at it through the holiday surge, was ICU capacity. That's the way he ultimately started making decisions about who was yellow, who was orange, who was red, is who had hospital capacity. So, who knows how they're going to look at it in the future. I'm not worried about Ontario County because Ontario County is smart, and Ontario County has shown we can do it the right way. So, with the amount of people that we have vaccinated, normal herd immunity, and Mary will know this better than I do, but normal herd immunity for like a flu season or any other virus is around 50 to 60%. The epidemiologists are telling us now that for COVID, it's around 75 to 80. It's a guess. That's what their expectation is, right? So, we bang out 20,000, 30,000 more vaccines and we get up to 60,000. Are we actually at herd immunity at that point? But then we also got to hope that the people that are coming up from Long Island and coming up from downstate are acting more like us and not acting like downstate, because downstate was a disaster through all of this. People think I'm nuts when I say this. If one thing could have happened differently that would have eliminated all of this, in my opinion, they should have quarantined New York City at the very beginning. They should have put a wall around New York City. If we put a wall around New York City, we wouldn't even be having this conversation today. But they wouldn't do it. And there are people who brought it up. You can go ground zero for this ad nauseum, because it was all the European strains that came to the New York City airports that spread throughout this country. Yeah, it happened. There was the Asian strain that happened out in Washington the one time. That didn't go anywhere. It was the European strains. They should have put a wall around New York City. We wouldn't even be talking about this right now.
Correct. I have to agree with you, Mike.
Wow. Well, we're here now, and thank heavens we've got the leadership we do. One of the questions that's really pretty compelling in the queue, and I've heard it in more than one area, and it would be interesting hearing your viewpoints on it. Do you anticipate that in the future we will have an annual COVID vaccine, much like we have an annual flu vaccine?
I would anticipate we probably will, but
Mike,
it's
your
uncertain.
thoughts?
They're not sure, but they're probably will need to. They're saying they're not sure yet, but they are saying, even on this morning's call with epidemiologists from the state, they're saying that the vaccine should be effective for a good time. And we are seeing people who've had COVID on both ends of the spectrum, where some do still have antibodies after a year, and then some, even after 30 days, do not. So anticipate we may want to recommend the flu shot, but that's still to be determined. They're still studying that.
And if anything, it might be like a booster, just
Yeah.
kind of the booster that you get for other
Gotcha.
vaccines to just kind of give you that thing. One thing that everybody needs to understand too, these coronaviruses, they've been out here for hundreds upon hundreds of years.
Yeah.
It's the common cold, right? But then they mutate and they get worse. So we've been part of this. We have seen this. This virus just over time may end up basically going away. But the problem is what comes next. We're not done with this. This is going to happen again. Maybe not in my lifetime, but certain other people's lifetimes in this phone, on this call, but the good thing is that we hopefully learn our lessons and we're prepared for it and we mitigate it as soon as we can and move forward as soon as we can. I don't think you're going to see another shutdown. You can't. I mean, it's just the financial impact of this has been beyond enormous. It's been great to get all this federal bailout and all this federal help, but those bills are going to have to be paid someday. And that's a problem.
True.
Totally different conversation, but that's a problem.
Yeah.
We may not see a shutdown again, but we may see requirements of more other options, more testing, that kind of thing. But the more people get vaccinated, the better off we're going to be. And just try to encourage everyone to, for themselves, for their family, for their community, take the vaccine. It's safe.
And the thing we do need help from everybody, and Ethan's been a huge help to us, is we sent out our link to our clinics. You guys know your neighbors who are shut-ins. Your neighbors who might not have, internet access. When we send out those links, get those people signed up. We've got to make sure that we're getting that population that we can't reach through social media and that kind of homebound population, working with us, working with Mary. We've got to get those people vaccinated because they are a very vulnerable population.
Right. We've been working with the Office of the Aging, and they have been actually registering people who do not have access to the internet. And we've done several hundred. And so if you know someone who has a challenge like that, have them get a hold of the Office of Aging and they'll help them get going. Also, we're compiling a list of homebound. So if you know someone who's truly homebound, bedridden, and will not be able to go to a clinic or to a doctor's office even, please let us know, and we will send a nurse in the home.
Thank you, Mary, because I suppose that's the kind of thing we make faulty assumptions about too, that if you're homebound, how could you possibly get sick? But let's see. How do the folks that are homebound get their services? They get from people that come and go and work with other people in other homes. And that brings me to, I hate to leave us, well, maybe we'll work past it and end on a nicer note. There's certainly an undercurrent of anti-vaxxers, and I hate to use, that sounds like an antagonistic term, and forgive me, but there is certainly a segment of the population who is hesitant to use a vaccine. I'm not going to ask for recommendations on how to manage those people. I'm wondering if there are maybe recommendations you all have for those who live or work around those people.
So I go back to what I said when I first started talking: get COVID or get the vaccine. It's that simple. You're going to get COVID. if you don't get the vaccine. But we do, we encourage them to talk to their community providers, their PCPs who they trust. The big hesitancy group was young females of childbearing years when this first started coming out. So we did a lot with the American College of Obstetrics and Gynecology, who recommended for women who are pregnant or trying to get pregnant, get the vaccine, because the known side effects of the vaccine are far minimal to the known effects of COVID, because it can kill you. Nobody's died of the vaccine, regardless of what you see on any of the news channels. Nobody has died of the vaccine, and the media has just, we're not going to end on a negative note, but the media has just not been anybody's partner through all of this. They've blown so much of the proportion, created so much hysteria, and quite frankly, haven't reported facts. So, but let's end on a positive note.
And one of the things I want to say is I want to thank the community. It has been amazing. And I mean, I can't even find the real right descriptive adjective to say how grateful personally I am for all the people that have stepped up and volunteered. The number that have helped us deliver meals to those who, through Meals on Wheels program, for those who helped us at our clinics, all the nurses that have come out of retirement to help us vaccinate. It's just astounding. I have somebody here every day helping us answer the phones because I have limited staff. It's been amazing, just amazing that you put the call out and our community responds. And that, for one thing, gives me chills in terms of I'm really proud that I work and live and play in Ontario County, because this is a great place.
I'm going to ask for a PS because I've got so much brain power on the line. One of our advanced questions that we haven't addressed directly is it's about masking in the workplace. Some people call it a bubble. Some, folks that are customarily working in the same environment together. The CDC has stated that you can gather indoors with fully vaccinated people without wearing a mask. What advice do you have for employers when their employees are asking if they can remove their masks in the workplace? What continued precautions should employers take? And the reason I save that for the end is when we all hang up, most of us are going back out to our workplace. And this might be a great little set of walking instructions for us.
At the county, we required of all of our employees, if they're leaving their desk, if they're sitting with somebody close without barriers, then they have to wear it all the time. Even if you do have a vaccine, it's not 100%. There's still a percentage that it does not work for, and so we still recommend that you wear the mask.
Mike?
Same. Unless you're in your house, you're wearing your mask. If I'm sitting in my desk over there, Kurt's here, we don't have a mask on, we're 12 feet apart, and we're both vaccinated. But you're within that social distance, you're walking around the hospital, you should all be wearing your mask. You got to just continue to protect yourselves, because we still have so much to learn with this. Eventually it'll stop, but it all comes down to ending this and getting to herd immunity.
Yep.